Having me. I am Dr. Sarah Bahrenburg, and I'm going to be speaking about the rape kit backlog here in the United States, and its impact on survivors of sexual assault, and why the DNA evidence from those kits is so necessary. So this is just a breakdown of how the presentation will go. Introduction, what is a rape kit? The rape kit backlog itself. Sexual assault reporting and prosecutions are significantly low here in the United States. The impact of the rape kit backlog on victims and survivors, and the conclusion. So, according to the Department of Justice, every 68 seconds, an American is sexually assaulted. So, you can see how prevalent sexual assault is in the United States. So, a sexual assault examination kit, also known as a rape kit, a sexual assault evidence collection kit, there's a lot of different names for this kit, but it all encompasses this one evidence collection kit. So, what is involved in this evidence collection and what goes into the kit itself? So, it's performed by a forensic examiner, so someone who is trained and certified in completing and performing a forensic sexual assault examination within a medical facility. Most of the time, it's a nurse, a SANE or a SAFE, so a sexual assault nurse examiner, sexual assault forensic examiner, but other medical professionals can also be trained to perform this, but the majority are nurses. It is an invasive examination, which collects physical evidence of a sexual assault. So this can include taking photographs of things such as petechiae, um, any ligature marks, if there's anything around the wrists or the neck, any other parts of the body that there might be some physical markings of potential ligature, struggle, things like that, as well as swabs for DNA. So that can be anywhere from bite marks that may be on the body. They'll also take photographs of that. It could be DNA swabs of the actual victim's mouth for their saliva, their DNA to rule out their DNA from their crime scene or other areas of their body, as well as swabs from the vaginal or anal cavities, or really anywhere on the body that deems appropriate to get a DNA swab. It can also include blood samples that would be for toxicology reports. If a survivor um, is claiming they've been drugged or they had a lot of alcohol in their system, something like that, the blood samples would look at that to see what kind of drugs, or if they were even on any sort of substance. Um, so a sexual assault examination can take multiple hours. The examination itself, I don't want to say is fairly short, but it doesn't encompass the whole few hours. There's a lot of other things that go into it, like a uh, a mental examination or just getting history of the patient, as well as just, asking about what occurred at the sexual assault that they are in for. So the test itself, the examination itself, encompasses a lot of different pieces. So the physical exam is not the full hours long examination. It can be other parts of it as well. And in most places, they will also test for sexually transmitted diseases or HIV. And patients can also opt to get things like PrEP to ensure that they hopefully do not get HIV if they have been exposed to it. So that's also a process that's ongoing because they have to come back to get more testing and get more medication if they opt to do that as well. And that's a few months later. So the kit itself, once it's actually completed, it then goes from the hospital or medical facility where it was done to the police department or the crime scene laboratory for actual testing. Now, as we know, that does not always happen. So that's where we will go next. The assault examination should be performed within 72 hours of the assault. That just ensures that there is enough evidence, especially DNA evidence, um, on the person to get proper and appropriate amounts of DNA so that they can actually test it. Anything further than 72 hours, the DNA evidence is either completely gone, it's destroyed, it's not enough to gain, a proper profile, something like that. So it's advised to do it within 72 hours of the assault. And obviously, when a survivor doesn't know that they're even coming in for an exam, if they decide a couple of days later that they're going to come in for an examination, most of the time they will have showered, maybe multiple times. So it's usually, best practice, if a survivor is willing and ready to come in for the examination, to do it as soon as possible after the assault. And the survivor themselves has the option of utilizing that kit in the case, meaning they can report, which will then move the kit into evidence collection so that they can test it. If they don't choose to report, the examination kit will just go into a centralized facility and it will stay there until the survivor is ready to report it, and then it will come into evidence for that case. But again, as we know, there are a lot of times where even when they report and the kit is supposed to be tested, the backlog makes it much more difficult to test in a timely manner. So here in New York, unreported kits are kept in a centralized facility for 20 years, and that's required by the public health law. And they also have a tracking system for survivors. So they can go onto a website, they can put in their information and a PIN number for their case, and it will follow their kit. So again, this is when it's been reported and the evidence is already coming in to play in the case. So then they can track where their kit is. So just a quick rundown of the difference between an untested backlogged kit and an untested unreported kit. So the backlog kits are already reported. So a survivor has made a formal report to the police, or if they are a minor, then the forensic examiner is likely a mandated reporter and they will have to report it themselves. So these are the kits that are waiting to be tested, and these are those that are backlogged. And they can be untested for multiple reasons, which we'll get to in another slide. But really, it's protocol, it's lack of resources, things like that. Untested, unreported kits are the ones that the survivors have not reported. So they have completed the kit, they've gone through the examination, and now they're deciding whether or not they actually want to report. And that can take years for some people. So that's why there is that 20-year period that it stays in that centralized facility here in New York to ensure that if the survivor is ready, they can make the report and the kit is still there. So in 2022, an estimated 25,000 untested kits sat in crime labs and law enforcement agencies throughout the United States. And that was only reported from 30 states plus Washington, D.C. So we don't know how many there actually were. in total in 2022. And as you can see in 2024, it actually rose, and that's because 44 states were reporting. So we knew a lot more about how many kits were backlogged. But again, it was only 44 states reporting that 46,000 kits were backlogged. So again, we didn't know the full number. And as of now in 2025, again, we still don't know the full amount throughout the United States, but it is lessening, which is great. And that's partly due to the nonprofit and the backlog. So, End the Backlog is part of the Joyful Heart Foundation, and it's assisted in ending the backlog of the kits. So, they have 6 legislative pillars of comprehensive rape kit reform that they are trying to push into all 50 states, plus the Washington, D.C., to ensure that rape kits are no longer backlogged and that survivors are getting the priority and care that is necessary for their case to move forward and for them to potentially gain some closure in their cases. So this includes a statewide inventory. So the states need to know how many kits are backlogged in their inventory. So that's basically step one, is just inventorying the amount of kits that are backlogged, then testing those backlogged kits. So if they know that they have 5,000 kits backlogged, they can actually begin to implement testing on all of those backlogged kits. Then they would test new kits. So any new kits that are coming in a timely fashion, they can then also test those and not add to their backlog. And implementing a tracking system. So like I mentioned, here in New York, we already have that tracking system. So it's essentially just for victims to know at what point their kit is and where it is in the process of being tested and their case moving forward, which is also part of the victim's right to know. So that the law should mandate in every single state that victims know every stage of their case, where their case is, where their kit is, every single phase of their case, so that they are not left in the dark and they again don't think that they are not being prioritized. And then the last pillar is funding reform. So any sort of government funding, grants, anything like that, within the states to continue this backlog reform and obtaining actual testing for these backlogged kits. So this is just a map of the reform count. So this is where we see how many states have full reform, some reform, or no reform at all. So we see that the majority of them have some reform, and we do see that there is one state that's lagging behind and has absolutely no reform. So, and the backlog is really trying to push the remainder of these states to get into that darker blue area where they have this full reform. And then this is a map of the states that have gone through with some or all of the pillar counts. So we see that they range from 0, which is the same state that we saw has no reform, and then all the way up to 6. So we do have some states that, quite a few actually, that have all 6 pillars in place, which means that they are getting rid of their backlog, they have full reform, they're allowing their victims to know where their case is, and hopefully moving forward with that case and the prosecution of that case. And then here is an estimate of all the states of how many untested kits are there. So there are still a few states that they have not reported, so we don't know the extent of their backlogged kits. And then we can see the dark blue states are the ones where they no longer have a backlog. They've actually gotten rid of their backlog, which is an incredible thing. It's a wonderful thing, and it's something that we're trying to move forward through, of course, all states. So This is a comparison between quote unquote regular assaults and battery crimes versus sexual assaults and how it goes from reporting all the way to incarceration. Um, so we see on the left that out of 1,000 assaults and battery crimes, 627 are reported. Over on the right of sexual assaults, only 310 are reported. And then it goes down from there. Obviously, when we get to incarceration, the numbers are pretty similar. 33 for regular assaults. I hate using that word, but in comparison to sexual assaults, and then 25 for sexual assaults. So it's not very dissimilar in that respect, but the fact that the reporting of sexual assaults is so much lower than other crimes, that's a significant piece of information. And that's for a multitude of reasons. And that's why it's so necessary for um, all of these resources, police departments, crime scene labs, even just society as a whole, and prosecutors to really um, believe survivors and want to work with survivors to move their case forward and to really obtain as much information about their case as possible. And that again includes the kit, the DNA evidence, which is going to substantiate a lot of their claims because unfortunately, sexual assault victims of all crime victims are the least likely to be believed. So if they have any other corroborative evidence, that really substantiates their case. So here we see, why don't victims report? Multitude of reasons. Main reasons are that they feel like they're not prioritized by law enforcement, or that law enforcement has a bias against sexual assault victims. They feel like they won't be believed by law enforcement or by prosecutors. They feel shame about it. They feel that they are blamed as the victim, and that's again through some law enforcement as well as prosecution. Um, they feel that nothing will be done, and they again feel that there's not enough evidence. So that clearly shows, especially the not enough evidence or that the victim is being blamed, why we so desperately need DNA evidence from those kits to come in as significant evidence in the case to ensure that victims know that they are being prioritized, that there is evidence that is, again, corroborating their claims, substantiating their claims, to tell law enforcement and prosecutors that there is a case worthy of investigating and moving forward with and potentially arresting someone and incarcerating that person. So DNA evidence is such a significant piece of the puzzle because, like I mentioned, victims of sexual assault are rarely believed. It's usually a he said, she said thing. So if they have DNA evidence, if they have photos of a struggle, um, that's going to help their case significantly to say, hey, actually something did happen. You can see it here. It's physical evidence here saying that something occurred. It's not just a victim lying or a perpetrator lying. It actually occurred. So why is there a backlog? Also, a multitude of reasons. It's not prioritized by law enforcement. Same reasons as why victims don't report. There's law enforcement bias. Law enforcement officers are not necessarily trained in assisting trauma victims or understanding what trauma victims evidence when they are coming in to be questioned by law enforcement. They have a lack of trauma awareness. They have erroneous ideas of victim cooperation. Victims who have gone through significant trauma, such as sexual assault survivors, their memories may not be perfect. And, nobody's memory is perfect. So for someone who's gone through trauma, it's significantly less perfect than what any one of, standard brains would be going through. And there's also a heightened anxiety when they're having to be questioned by police, again, because of all of their fears that I listed prior. They may feel like they're being blamed themselves. They may feel like they're not being believed. So they kind of add more trauma on, more anxiety on, which then decreases their memory even more. And a lot of law enforcement officers are not trained in understanding this or knowing how to work with a person like this. So they kind of just dismiss it as they're lying or they're misrepresenting what happened, or they they don't uh they don't know what even happened. So, maybe there's no case at all and we shouldn't even look into it. Things like that. Um, and then also, which is a main part of it, is lack of resources, and that could be within the crime labs or the law enforcement offices. They may not have enough investigators. They may not have enough people to go through as many kits that are coming in. They may not have the equipment to process these kits as quickly as they would need. Um, DNA evidence really didn't DNA testing didn't come into play until the early 90s. So um, there were backlogged kits prior to that they really didn't have much they could do with aside from like the photographs or blood samples. So those kits, you know, speaking of lack of resources, they really didn't know how to test anything else that had come from those kits. So there were a lot of backlogged kits from those types of situations as well. And so this is the impact that it has on survivors. Um, Again, it's pretty much exactly the same as the reasons that victims and survivors don't report. Feelings of not being prioritized, feelings of law enforcement bias, that they won't be believed, that there's shame or victim blaming, that nothing will be done, that there's not enough evidence to corroborate what they're saying and substantiate their claims. And also, there are statutes of limitations that can run before a victim survivor even gets justice. So they could report their their case. Their kit could be completed. Their kit could be waiting to be tested. So it is part of the backlogged inventory. And they may not get to it in enough time that the statutes of limitations have run, and therefore they can't get anything done. And when this is perpetuated and this is survivors hear about this from potentially other survivors, um, then they may not even want to come forward to report or even get a kit done, even if they don't report it. So there's a lot of a cyclical events happening because if they don't want to report because of all of these reasons in the beginning, then no kit is going to come in. And then when people hear that, kits aren't coming in and all of these individuals are not being believed because they don't have corroborating evidence, then they're not likely to report. So it's just this big cycle that moves forward, and then back again. Um, and with those statutes of limitations, they can range anywhere from about 10 to 20 years, depending on what state it is. So, we keep the kits here in New York for 20 years, and that's with unreporting. So, you know, our backlog is significantly lower. I think we either have completed the backlog or we are very close to completing the backlog here. Um, so, we're not really getting close to having those statutes of limitations expire here in New York, but in other states it does occur. So if there's a 10-year statute of limitations to bring charges for sexual assault, and a kit has been completed and it is sitting in evidence, if it runs through that 10 years and it's not being tested yet, then that DNA evidence doesn't come in and it doesn't allow um, prosecutors then to have enough evidence to potentially bring charges. Or if they do decide to bring charges without that evidence, then a jury is likely not to convict. So again, it's this big cycle. When they're not convicted, less people are going to report because, again, they don't feel like anything's going to be done. And it's just going to be a huge waste of time and more added trauma to a survivor, which obviously we don't want to occur. So, testing backlogged kits has led to more than 15,700 CODIS matches. It's led to the arrest of 8,200 serial violent offenders and the arrest of 2,200 serial sex offenders. So it's clearly necessary for so many reasons. It's necessary to help a survivor, and it's necessary to ensure that um, with serial offenders that they're not able to continue to offend. If a serial offender does commit a sexual assault and that kit is backlogged, they don't get as much information about that offender, so they don't necessarily know who that offender is based on DNA evidence. And with a he said, she said case, as many of these sexual assault cases are, that person can continue to roam free in society and commit these violent offenses, sex offenses over and over and over. So clearly, with the tested backlogged kits, they were able to see that multiple kits showed that the same offender committed these crimes. So that's just one reason why the DNA evidence is so, so necessary. And kind of like what I just mentioned in the last slide, in 2009, during a routine inventory of the Michigan State Police Department, over 11,000 untested rape kits were found in a storage facility dating back as far as the 1980s. So 11,000 untested kits. And again, in the 1980s, we didn't have DNA testing. We didn't have the forensic analysis that we do today. So having these 11,000 untested kits, they probably were not able to be tested in a comprehensive and accurate enough way to, you know, to even bring forth any investigation or any charges against a perpetrator. So they probably maybe didn't even think to test these kits because they knew that, with possibly tested kits that they had before, there was nothing that they could um, glean from it to move an investigation along. So they probably, again, probably had the lack of resources to even test these kits and probably didn't feel that it was necessary because they lacked those resources and they lacked the appropriate analysis that was necessary to test those kits. Um, so again, charges may be filed before statute of limitations expires. That's also extremely necessary. So as mentioned, we don't want those statutes of limitations to expire before a kit is even tested because that evidence then cannot come into play. And without the DNA evidence, it's likely that an investigation will not go further. It's likely that prosecution will feel that they don't have enough evidence to bring into a case and actually prosecute someone. And if they do decide to prosecute someone without that DNA evidence, then it's likely that a jury will not convict that person. Um, and then lastly, it gives victims and survivors a feeling of belief it allows them to know that their cases are being prioritized and that they are believed by law enforcement, which then leads to more reporting, which leads to more testing, which leads to more prosecutions, and potentially more closure for the survivors. So, DNA evidence is one of the most crucial aspects of a sexual assault case. Again, because sexual assault survivors are the least likely crime victims to be believed on their word alone. We need the DNA evidence to come into play for anything further to happen and for survivors to feel prioritized and that their case is important to law enforcement, to getting a resolution and to getting their closure. So that is all I have. Thank you